All right, welcome. My name is Dr. Spencer Erickson at TeamView Chiropractic. Now, what we're doing today is a little bit different than what I've been doing. I've been doing a lot of podcast stuff, which has been fun for me. But what I want to do is I want to just do a series of short little videos where I just go over some cases, things that I find kind of interesting, that I think other people might find interesting as well. Now, I may be totally wrong. Maybe this is not interesting at all to you. But I think this stuff is really interesting, especially looking at things from a chiropractic perspective. What we're looking for really is I want to see areas of stress in the spine when I take X-rays. Now, sometimes what I'm primarily thinking of doing is just doing X-rays. That's what we're going to do today. I'm going to show you a couple sets of X-rays, things that we're looking for, because X-rays are one of the most valuable tools that I have. And in healthcare, it's so available, it's so safe, it's a great way to get things done and find out more information in the body. So what we're going to do is I'm going to show you some X-rays and just walk you through kind of what I'm thinking on these, and I'll introduce you a little bit to X-ray review, and so you'll get to learn some skills, I guess, with this. This is something that I really love. I love doing X-rays. So we'll just get right into it. Now I'm going to try to switch screens here without too much drama. Okay, there we go. Now, if you look here, I've got this X-ray here on the left, and this is a fairly normal X-ray. Now, interestingly, you see this horizontal line I put here. If you were to not have that line there, it really looks like that left hip is low. Now, what we're doing here is we're looking from the back. This is the right hip, this is the left hip. So pretend this patient is facing away from you, and you're just looking at their spine. If you just look at it, it looks like the left hip is really, really low compared to the right. But in reality, it's only a couple, maybe 3 millimeters. That's barely on my radar. I don't really care about changes like that. Now, just to give you a little bit of background here, what we're seeing here, this is a button and zipper on a pair of pants. These are rivets like you find in jeans. Now, as we look at this spine, you can see a few things. Obviously, you see the bones. Okay, we got left hip, right hip. Down here we've got the left hip joint, the ball and socket joint, and here it is on the right side. See this big long crack here? That is called the sacroiliac joint, or the SI joint. Here's the left side. Now the joint actually is all of this area. See this crack here? That's the lateral aspect of it, and here's the medial aspect of it. So these two bones overlap that much, so that there's that much joint surface here and that much joint surface over here. So you can imagine if these joints are torqued out of place and it's irritated, it can cause a ton of pain. This is where most low back pain comes from. Between 60 and 80% of all low back pain comes from these sacroiliac joints. And so it's really nice to be able to see those. Now we can throw measurements on here. There are a lot of different things we can do on X-ray, especially digital X-ray, which is really, really helpful. What I want to just do today is I just want to look at overall alignment of the spine. Now, here is L5. Okay, you see this right here. It looks like it's kind of a butterfly wing. What we're seeing here is we're seeing all the stuff, the main vertebra part of the body, the main body part of the vertebra, as well as all what's called the posterior elements, everything in the back, the neural arch and that kind of stuff, with the pedicles and the lamina and all that stuff. And that's overlapped here. And so we see a little bit different in 2 dimensions than what we would see in a 3-dimensional image. And so what we have to do with the X-ray is we have to understand what's behind it, what's in front of it, and what actually we're looking at. And so it's a little bit complicated, more than what we're going to get into today. Now, do you see this little thing here, this little oval, this little arrowhead-looking bone? All these things going up the middle of the spine, those are called spinous processes, and those are the bones you feel sticking out in the back. If you run your hand down your spine and you feel those bones, those are the parts of the bone that you're feeling, spinous processes. And you see these little owl eyes. There's one on the left and one on the right, all the way up. Here's another one, here's another one, here's another one, and so on. So those are called pedicles, and the pedicles basically are spacers in between the body of the vertebra and the back of the arch, the lamina, which is there to protect the spinal cord. And so these are little spacers there. It's really cool the way the body's set up and designed. It's designed very well, believe it or not. And so as we go up here, you can see all the vertebrae. We got L5 and L4 and L3. Now you see the space here in between. That's where the disc lives. This view, the anterior to posterior view, or A to P view, is not the best view to look at the disc spaces. So we're going to look at the lateral view, or the side view, in a minute, and I'll point some things out. Now what I want to do with this is I'm going to bring up another X-ray that was taken 4 years after this one, 4 years and a couple months. There it is. So this is the exact same patient. It's just 4.5 years older. And so you can see here, look at this. Left hip actually looks a little bit lower than the right. Now it's a little harder to discern that it is lower because we've been looking at the other one so long. But look at this. See how we've got a little bit of arch here, a little bit of curve here in the low back that wasn't there before. Now otherwise, everything looks about the same, which is what we want. Now, of course, we've got differences in contrast and that kind of stuff. Two different people took the x-rays with two different experience levels. And the settings were slightly different. I like the look of these x-rays. I like the look of x-rays differently than I liked the look of them 4 or 5 years ago. So these are taken on the same machine. You can actually see pixelation. See pixelation here on this one and pixelation here on this one. And my machine does it like that sometimes. Now, you may notice, because this one's got a little more contrast, see this big dark splotch there. We've got all this dark splotch here. This is actually bowel gas. This is totally normal. Everybody's got it. Here's kind of the same thing here, bowel gas, just air bubbles in the intestines. So nothing to worry about on any of that. But that's what's going on here. You can see a little bit of a left lateral curve going through here. Now the interesting thing is actually on the next x-rays, which are the lateral views. Now when we talk about lateral views, what we're talking about is a side view. Okay, here's a side view of the low back. Something that I really like about this is it's very arched like this. We're supposed to have a C shape in the neck and a C shape in that lower back when we're looking at it on x-ray here. Now, you see this little half moon here? That is the ball and socket of the hip joint again. So we're looking at the low back from the side. Here is one ilium or one hip bone, and here's the other one. So they actually overlap really nicely here. Same thing here, one ilium, and here's the other ilium. And so we're seeing these bones right through the big ilium bones. Now, the interesting thing about this, and this is important, when people come in to look at x-rays with me, I have to look at things that are changing and things that it look like are degenerating or breaking down. Those are our injury sites. Now, if you look in between the bones, see that great big gap? Okay, that's where the disc lives. We have a great big gap here and here and here. This disc space actually looks really good too. Okay, so this is looking really nice. One thing that I am going to point out here, look at the back corner of this bone. Okay, see how far back this is relative to right here? So the back corner of the tailbone or the sacrum is shoved up underneath L5. Okay, so this is what I call a posterior L5, or L5 is actually shifted backwards. Another term for this is called a retrolisthesis. Now this is a mild grade 1 retrolisthesis, but it is actually, this is an anatomical condition because the bone is shifted backwards. And so there's a very specific way I need to adjust this to make sure that this disc doesn't degenerate. Now, 4 years later, and I will tell you the history on this patient in just a minute, but 4 years later, look what this looks like. So in between the bones, you see the gaps here. Same thing over here. Nice big gaps here. But look at this. Can you tell that the L5 sacrum disc has gotten smaller? It's a little bit smaller than this one. Okay? So we're smaller right here especially. The shape of the bones is largely the same, which is really nice. But look at that retrolisthesis. See how obvious it is on this one? So it actually looks like maybe it's progressed a little bit backwards, and it looks like the disc is actually degenerating. So this is one of the problems that I run into. When there are people who are not getting adjusted properly in the area that needs adjusting. When I look at this, if this person came in to see me, what I'd be doing is I'd be adjusting that L5 forward every single time I adjust them in the exact same way, because I need to rehabilitate an old injury in here that never got rehabilitated properly. If I don't do this and do it enough times in a short enough time frame, then it's going to turn into this. And guess what's going to happen to this over time? It's going to completely wear down, and it's going to get worse and worse until it eventually is bone on bone. And we've got nerves here that there's going to be a lot of pressure on those nerves, and so those feet are going to start falling asleep, and other bad things can happen, pain going down the legs and that kind of stuff. So some serious things can happen because of this. So when somebody comes in and I make recommendations, it's because we need to rehabilitate the problem in there and get it adjusted very specifically so I can make the changes that I need to. Well, it's actually the body making the changes. I'm putting the stimulus into the body, and then the body actually makes those changes. But if we can rehabilitate the joints and the disc here, and so they stop breaking down, then it's going to look like this instead of like this, and worse and worse and worse for years and years. Now, over the course of 4.5 years or 4 years and change, this has turned into this. That's a big problem. Now, one thing that I should probably tell you is that these are my x-rays. These x-rays are of me. I just had I have a new front desk person that we're training, and we're training on doing X-rays, and so they asked me to come be an X-ray model, and so I stood and had him do X-rays. I've needed new X-rays anyway, and so we did X-rays of my lower back, and this is what I found. Now, how could I let this happen to me? Well, the big problem that I ran into is that there aren't a lot of chiropractors that adjust specifically around me that I can go to. Usually when you go to a chiropractor, they'll put you on your side and they'll just wrench you. Let's see how many pops I can get out of that low back. Almost every time they're adjusting above that L5 disc, or they're adjusting it differently than it needs to be adjusted. I don't need to be adjusted into rotation. When you put me on my side and twist my low back like that, it's adjusting me in rotation. I don't need that. My low back doesn't need that. I have no low back pain. My sacroiliac joints are very healthy, but I do have this issue here. And I have not had anybody be able to put me in side posture and adjust that L5 forward the way that it needs to go. I love doing that move because when people come in and they're hurting and they've got a posterior L5 similar to mine, I adjust that thing and bam, it is better. It takes off so much pressure. Now, one thing that I also need to understand, I've been doing CrossFit for the last few years. The people that know me understand that. And I've been lifting heavier and heavier all the time. And so I need to be careful to make sure that my form is impeccable. And sometimes I know it's not, especially on deadlifts, because I'm a small guy lifting heavy weights. And so I've got to be sure that I take really extra good care of my lower back, especially with that shift backwards that we see in that L5. When I'm putting a big load on this, you can think of, if I'm bending forward on this and putting a big load on it, the disc is, it's going to get pinched right here between L5 and the tailbone. And I don't want that pinch to happen. And so there we are, as I go about my lifting schedule and as I, go about getting adjusted, I need to be sure, especially going from here on out, because I didn't know it was progressing like this until we took X-rays. From here on out, I need to be teaching other chiropractors how to adjust me, and so I can get adjusted properly. Now, I've got stuff going on in my neck, but it's really simple, basic stuff. I've got a C5, and maybe I'll show you that sometime. But what I wanted to do today was just kind of explain why I do things the way that I do. If we don't adjust the spine very specifically, it's not going to make the changes we need it to make. So a lot of people will come to me and be like, yeah, I went and saw my chiropractor for a year. He adjusted me 3 times a week for a year, or twice a week for a year, or some huge plan, twice a week or 3 times a week for 6 months and twice a week for 6 months. That's not uncommon. That's thousands and thousands and thousands of dollars. And they come to see me and it's like, no, the joint is not rehabilitated. And so I need you to get through another program. And it's frustrating for them and it's frustrating for me because I don't want to be the cause of more stress, and I don't want to be, thought of as some guy who's just in it for the money and in it, it doesn't matter what they've been through before, everybody else is wrong. No, it just needs to be done correctly. And so it's really a big deal for me when people come in. I need to understand what's happening. And so X-rays are the very greatest tool that I have for that. We don't do the pregnancy, we don't do little kids typically until they hit a certain age or a certain level of symptoms that we just need to take imaging on. So we'll do an X-ray. But this is such a great and powerful tool. Now I know how I need to be adjusted better, and I need to be better at having other chiropractors who adjust me the right way every time. So anyway, that's a quick case study for you. I hope you enjoyed that. We'll see what happens. I'm gonna upload this, and we'll see if there's a response on it. But this is something that I like doing, and so I'll probably put up a few more, and we'll see if I've got time to do this and see if we enjoy it. But anyway, thanks for watching. I hope you have a great day. If you need to get in touch with me, the office number here is 801-762-6940. TimpView Chiropractic. You can also email timpviewreception@gmail.com or dr as in Dr. Spencer Erickson @gmail.com, or you can just find me on Facebook at TimpView Chiropractic. So if you have any questions, let me know. Otherwise, I hope you have a great night. We'll talk to you later.